Cool. So I'd like to maybe give a basic introduction to what pediatric residency is. What is the specialty? What do you typically deal with? And then what does it mean to be a resident?
Sure. I think being a resident, I think, has a lot of different roles. I think primarily we think of it as a training for 3 to 4 years. It could be up to like 5, depending on specialties. I'm fortunate that the specialty I chose has the fewest amount of years, so 3 years. So it's after medical school, after you graduate with an MD or a DO, you're officially classified as a doctor, and then you start your training at a institution that you get matched at through the match system. And then you essentially rotate through different areas of your specialty. So at least for pediatrics, that means I'm rotating through wards, which is like hospital medicine. So it's all the patients that are admitted with like not super serious illnesses, but need to be in the hospital. So right now we see a lot of asthma kids, a lot of bronchiolitis, a lot of sickle cell, different things like that. So we rotate through specialties like that. We rotate through other rotations like the PICU or the pediatric ICU. We do a lot of outpatient. That's recent. The ACGME, or our accrediting body for residency, has made it an initiative to have more outpatient rotations, which is more like clinic-based, things like that, rather than inpatient rotations like hospital stuff. So we kind of bop around different rotations throughout residency. And by the end of 3 years for me, I'll be an attending physician if I choose to go into general pediatrics. So like your general pediatrician that we all had growing up. And if I choose to do another fellowship, that'll be, for me, at least another 3 years into a subspecialty of pediatrics.
And are these rotations like intended to help you maybe explore if you wanted to continue past general and pediatrics?
Yeah, I think that's exactly what the intention is. So, we really spend a couple different weeks in the different months on different subspecialties. So I will go into gastroenterology or GI in the next week or so. So I'll spend about 2 weeks on the inpatient rotation and then another week on the outpatient rotation. So similar to this, I will get experiences in pulmonology, in hemononc, which is hematology and oncology, so blood disorders and cancers. And so I'll kind of go through different things. And my ward specialty is kind of more of a general pediatrics thing. So I see a lot of different disease processes, a lot of different pathologies. The main intention, I think, of going through all these different rotations is to have exposure to them. So if you decide to specialize, you have a good understanding of what you're getting into, versus being a great general pediatrician. I think being a great general pediatrician means that you know a little bit about everything, and then when it's kind of out of your scope, you refer to other subspecialties. So the main rotation or main intention is to have a good understanding of all the different things that can go wrong in a population of newborn to 21 years old.
And I used to think at some point like residents tend to already know what's going on and they're kind of just like in a sense practicing. Are you essentially still like continuing to learn new things every day, or is this kind of like putting what you know to the test and implementing it with actual patients?
Yeah, I think it's a bit of both. Funny enough, during your 4th year, after you match, there's a lot of downtime to like kind of explore yourself again and find your hobbies and find your personality again. So that is a time where I don't think the intention is to forget everything that you like learn in medical school, but that does happen. It's a very real thing. So I think it's a little bit of like me seeing stuff that I've seen in medical school and being able to implement the knowledge that I've had from medical school, but it's also like I'm learning new and different things. I think one of the biggest things coming to residency in Atlanta at a much bigger academic institution is that I see so much more here. I remember being on my pediatric cardiology rotation at Prisma, and a lot of the things that we like kids be on ECMO, which is like a very how do I describe this? It's essentially where your blood gets taken out of your body and then put back into your body with some oxygen. That actually got transferred to, or we sent them to Charleston. So things like that, I didn't really see in a smaller institution like in Columbia, but I see everything here. So some of this stuff I just never knew beforehand because I didn't really have exposure to it. But Emory being a really big catchment area, meaning that we see people from all over Georgia, some people from Florida as well. I've been able to see so many more pathologies than I probably would have seen at different places. So it's a little bit of both. I would say some of it's my knowledge coming through, and a lot of it is I'm learning as well. So the whole point of these 3 years is that you're training to be a fully independent doctor. Right now, I have a supervisor, so I'm not independent in any sense just yet, but I do have autonomy that grows throughout my years. So as an intern, I always have my seniors or my second and third years watching me. And then as I start to level up, essentially as a third year senior, I'll be a lot more independent than I was as a first year. So it's kind of both.
And is there any additional like structure or like are exams still a thing in residency, or is it mainly like working in a hospital and
It's
outpatient?
mainly Yeah, it's mainly working in the hospital and some outpatient time as well. That is a good part about residency. I don't have to come home and study per se. Like a lot of what I'm doing in like day to day is learning, and it's a lot of studying. And the fact that I see it a lot, like I see the bread and butter pediatrics, so the asthma, the bronchiolitis, the things that you will see at any hospital that you're at, with the kind of zebras, like with more like congenital heart conditions, things like that. Um, a lot of it's just learning day to day, and I kind of learn through that practice. So it's nice that I don't have to come home and study. But something that I didn't know until honestly last year was that, so we do different boards exams. So in medical school, you do step 1 and step 2, which are like the USMLE exams. And then step 3 is something you take usually after intern year or within the first 2 years of residency. What I realized recently is that it is not specific to your specialty. It's actually all of medicine. So it's very similar to step 2 in that I will need to know adult medicine going into this exam. So I will eventually have to study for that, but otherwise I don't really study for much else, which is really, really freeing.
And do you also have lectures and like classes too, or you don't have that either?
I wouldn't say we have classes. We do have lectures in the form of like morning reports. So like on specific rotations, we have different residents presenting things, or we have attendings coming in and presenting things. So one of my favorite things is like the night residents will, for one of our morning lectures, they will present on a interesting admission that they saw the night before and kind of ask for like, did we do the right thing? What should we have done else? What else should we have done? So it's like a lot of learning. I wouldn't say it's classes, but we do have lectures. And then my program is a little different in that we have a specific week where on Thursdays we get like a half a day of lectures. So not really courses, but we do learn a lot. We do have a lot of like direct like lecture time, I guess.
Cool. Okay. I'd like to maybe transition to talking a little bit about your specialty. So, I guess what are some, and you mentioned like Emory, you get to see a lot of really cool cases from they bring in people from surrounding states too. So what are, maybe do you mind sharing one or two interesting patient cases and maybe your role in that patient case as a resident?
Yeah, let me think. I think the one that comes to mind is that there was this one. It was a 12-month-old girl with congenital neutropenia, which essentially means that you're born without some specific blood cells or neutrophils that are really important in fighting infection. So this child was born this way, and so she, anytime she had a fever, she had to be brought into the hospital, which really meant that she kind of lived in the hospital. She was really at high risk of getting all these infections. So she was on like 3 or 4 prophylactic antibiotics, which essentially means that she is always taking them to prevent any kind of infection. And then when she does acquire an infection, she gets put on more antibiotics. I think that was a really interesting patient case because it felt like the whole hospital knew her. She was like, a lot of the residents took care of her. I was, afforded the time I was lucky enough to take care of her as well. But she's someone that stayed on my mind. She actually passed recently, which was really sad. But to be able to learn from her and have the opportunity to be part of her care was really special. But my role on that, on her as her being a patient, was being her primary provider essentially, or primary clinician. So I if I like went through a typical day, I was the one to pre-round on her. I would present on her to the attending, and then her family. It was just a very interesting social situation. So we had a lot of family meetings with with family members. So you're kind of like the primary medical person in all of the scenarios when you're a resident. I think a lot of our attendings give us the autonomy to be that primary person for your patients, and I think it really helps you grow. So that I think was an interesting patient scenario that I've had that I probably will remember for a while.
Yeah, that kind of leads me perfectly to the next question is, I'd imagine working with pediatric patients is a little different from adult medicine in that, um, I guess it could like take a greater toll mentally. How is that? How do you deal with that? And I guess like what are some like coping mechanisms or strategies that you use?
Yeah, thankfully that's really the only scenario that I've had so far. I wasn't in, her direct doctor at the time when she passed. So um, that was a little bit, it would have been a lot worse if that was the case. Um, yeah, so I'm still working on that too. I'm not really sure. In medical school, I was I had a rotation in the PICU or the pediatric ICU where I saw two kids pass, and it was a very unusual week. I remember the attending saying like, this doesn't really happen. Like a lot of kids come here and they get better and they go home. And there is obviously the chance of them passing, but it was a very unusual week. And I remember being so distraught about all of the events that were happening. And I told myself that myself was never going to do PICU because it's just a sad place. I haven't had the chance to kind of redeem that just yet, that kind of feeling associated with the ICU, because especially at Emory, the PICU is like a second year rotation, so I haven't had the chance to do it just yet. But a lot of my colleagues want to do it, so there's a lot of like gratification that you get out of doing rotations like that, where you get to see patients at their worst and making them almost back to normal. I don't think that that's for me. That could change. Don't hold me to that. But I think a lot of it is that you just have the people around you to be able to talk about patients, talk about things. Obviously, not sharing HIPAA details or anything, but just having people around you. In our residency program as a whole is super supportive. So my fellow residents have been reached out to if they're on service and they have um, a direct patient where that unfortunately had a bad outcome or something, and they're provided resources to talk to, and just have like someone to listen to, or having someone to share kind of those feelings with. So I think having a supportive residency program, but also people outside of medicine to kind of share what you've been going through is like really, really important. But that's, again, a skill that I'm working on too. I'm sure in the next couple of years, I will build more skills kind of to deal with issues like that. But a lot of people think that pediatrics is a really sad specialty. And I will say that it's sad some parts, but it's really, really rewarding that you get to see a patient get better so quickly. I think that's like the greatest part of pediatrics, is that they bounce back so quickly. They have short admissions. They're not here for a very long time. And it's always so happy. Like we dress up for like every single holiday. We have mascots. We had Miley Cyrus's sister, Noah Cyrus, come in recently and have a little concert. So like I don't know, we have a lot of fun on the pediatric side. I think it is a great specialty, and I would encourage everyone to do it.
That's cool. Yeah, I wouldn't even imagine. So it is a hospital, but at the same time, it's supposed to be a like supportive, caring, and I guess like fun environment for the kids, right?
Yeah.
Um, do you have a lot of like I guess like long-term patients or patients that stay there pretty regularly and like maybe like activities or things that they do to keep them happy and excited to be there?
Yeah, it's a little bit harder to get continuity in residency, since we're just like spending a couple weeks on one rotation and going to the next and going to the next. But a lot of our patients get involved in different things that the hospital provides. So recently, well, actually, one of the things that kind of is a year-round thing is our therapy dogs. So we have a bunch of therapy dogs. There's like an Atlanta or CHOA, so Children's Hospital of Atlanta therapy dog Instagram. So it's really nice. You get to see all the therapy dogs. We have one specifically for like faculty and staff named Tomato, and he's really cute. But that's always available to all of our children. Child life is kind of a national thing. Like most hospitals have child life that interact with patients, like for IV sticks and like different diagnoses. They're always there for really support and help. We also have something called the zone downstairs, which is like this huge playground filled with stuff. So there's like a basketball court outside. There's a lot of like video games and different games set up indoors. Um, so we have so many things. And recently we had I think like a mini Christmas tree party where all the patients got to come down and choose like a Christmas tree to put in their room. So like there's so many things that we do, and we just have so much fun. But going back to the continuity question again, I haven't seen the same patient in an inpatient setting just yet, like the same like for a second hospital admission. But what we do, we have an X plus Y system, which is a little confusing to talk about, but essentially we have 4 weeks of our X weeks where we have like kind of a harder inpatient rotation, like our ward system or rotation. And then our Y week is their 5th week. So it's a 4+1 schedule where you have 4 weeks of X and Y, or 1 week of Y. And our Y week is supposed to be a chiller rotation. We do like clinics, we do like mental behavioral health. So things that are supposed to be more chill, more outpatient rotations. And so on our Y weeks, we do our continuity clinic, which is essentially a couple days at a primary care clinic in Atlanta where we see some patients. So that's where I've seen most continuity. I've been able to see some patients that come to our to a pediatrician visit, like their well child visit, several times during their first year of life. And I had a really fun case of continuity. I was in the NICU for 4 weeks, and I had a patient for 2 weeks. And I remember telling them on their last day, like the day of discharge, I was like, well, you need to go to a pediatrician's office like within 1 to 2 days. And I totally forgot that I started my Y week the following Monday, and this was like a Friday. So I actually referred her to myself, which was really fun. I like realized that while I was talking to her, and I was like, wait, I guess you'll see me. So it was really nice to like see them again and seeing them in a different outpatient setting and talking to them about how, life was with a new baby at home, after having this NICU baby like in the hospital for 2 weeks. So I think that was a really rewarding experience, and that's something that I am like looking for as a general pediatrician or like as a subspecialist. So I think that's one of the most rewarding things, that you see them so frequently, like children throughout the first year of life and throughout the whole time that they're with a pediatrician. So until they're almost like 21 in some cases, which is really nice. You just see the growth that they have, and you really get to like watch them like sprout into their own person and find their own personality.
Yeah, yeah, I'm also interested in pediatrics, and that's kind of my like the appealing thing to me is I get to watch them grow up.
Yeah.
So I guess when people typically think of pediatrics, so they think of their like primary care pediatrician that they go to.
Mm-hmm.
But if you're a pediatric hospitalist, I would imagine every patient you see is sick in some way or like struggling with something, right?
Yeah, that's correct. Yeah, so like in our wards or hospitalists rotations, we see kind of like what I talked about, like the kids with asthma, kids with I don't know, like sometimes we'll see failure to thrive. So a lot of children that aren't growing well and they need to be admitted for like an NG tube, like a nasogastric tube to like deliver their feeds. We see a lot of neuro issues like seizures. We see that very frequently. So yeah, things like that. Those are like the bread and butter of what we see.
Okay. And
Hmm.
then I guess a lot of physicians that I've talked to said that the challenging thing about pediatrics is you have to communicate with the patient, but also there's communicating with the parents. And
Hmm.
obviously, communicating with the patient and the parent probably looks very different considering the age difference and a bunch of other things. I'm sure parents could be worried, frantic, nervous. What does that look like, and how have you learned to kind of adapt both ways of communicating?
Yeah, I kind of figured that's what you would say, because I think a lot of people are turned off from pediatrics because they feel like you're also treating the parent. I think that's one of the rewarding parts of pediatrics. You get to interact with the whole family. It's really nice to see like where this child is from. Like you get to see like traits that the mom has, that the child has. It's like, I don't know. I think it's really fascinating. Um, I do think it's challenging in some scenarios. At least what I'm seeing a lot of, and what has been challenging in my own practice, is like convincing parents to give vaccines, especially with the political climate that we're in now. But I think what I have to remember is that we're both here for the same thing, like me and the parent, like we're both trying to make this child as healthy as can be. And if that comes in the form of vaccines or whatever it is, like I think reminding a parent, like if we're having a little bit of like, we're talking about like if they don't want to give vaccines, for instance, and I am really trying to push that and recommend that, it's always a conversation. And I don't win all of them. A lot of the times I'm like, okay, we'll talk about this in the future. I don't think this is something that we're going to get to the bottom of right now, but just reminding the parent that we're on the same team, and then we're really trying to have the best outcome for this child, to grow up healthy and have a really healthy and normal life, is both of our goal. And just kind of centering the conversation to be something like that, I think it's really helpful for not only me, but for the parent as well. It can be challenging where I see a lot of children that come from neglect or abuse or things like that. And when the parent is not someone you can, I guess, really trust in those scenarios, but a lot of the time they do want the best for the child. And you kind of do have to treat them as your own patient. But again, I think that's a really rewarding thing about pediatrics, that you get to know the whole family in that sense. And you're really on a team with a parent to help like a child that's in a vulnerable position, and make sure that you can give the right recommendations.
And so when you are, I'm sure there's like hard conversations that have to be had, whether it's like trying to push for vaccines or also like bad news or anything like that. And I guess it's even more challenging when you have to talk to the child on top of the parent. So are these things that they prepare you for? Do you get a lot of practice, training, and like advice on how to effectively have these conversations?
I think we got a good bit of training. I think a lot of it comes in the form of informal conversations with attendings. I know sometimes like on my Y weeks or during my clinic weeks, I come back from a patient interaction. I'm like, I unfortunately did not get through to this parent. I couldn't convince them to give this vaccine or something. And a lot of the times, like something with like the flu vaccine is important, but it's not the end all be all to not get like the flu vaccine. But like if it's like one of the childhood immunizations, it's much more serious. But I several times I've come back from patient encounters and I was like, how could I have done this differently? How could I have actually gotten through to the parent? And a lot of attendings will give their advice. They're like, this is how I approach it. These are the specific words I say. And I take that into my own like talking with parents and my own clinical skills. I think I like to take a lot of things from a lot of different attendings. I like to like put in my toolbox and like different ways they say things that I've seen, like have visibly seen, kind of gets them to be on your side. So I think we got a lot of more informal teaching more than anything, on kind of that. And I think that's really different because this is like a very specific specialty thing for pediatrics. You just need to learn how to interact with the parent. So I think we get a little bit of both, but you learn by doing. That is the biggest thing. Like I am learning, and I think in a year I'm going to have a different way to talk to parents about hard conversations, and that's something that I hope evolves, because I know I'll be better in a year and better in 2 years.
Yeah, I would imagine like trial by fire is probably
Mhm.
the most effective way to learn that. I guess there's gonna be like awkward conversations
Mhm.
or things that you could have said better, but you
Mhm.
definitely remember it more when you make a mistake.
Yeah, absolutely. And also during medical school, like knowing that I wanted to go into pediatrics, you do have a lot of rotations that are in pediatrics. So you do learn a lot of skills in medical school. You're not coming in blind to residency.
Yeah.
So there's always time for learning, and yeah, you'll get there. I'll get there too.
And then last question about your specialty. So what are some like typical subspecialties that people go into, or the more common ones and maybe a few uncommon ones if you know any?
Yeah, so pediatrics as a fellowship, or like as a subspecialty, has its own perks and a lot of not perks, unfortunately, if I'm comparing to adult medicine. So one of the biggest changes that has happened recently, to be a hospitalist or to be a pediatric doctor that like is in the hospital on the wards, with patients that are admitted for not super sick things that go to the PICU, but things that need to be admitted, like again, like the asthma or like any kind of like dehydration requiring IV fluids. That type of doctor, in the past, I think in the past like 5 to 6 years, or maybe essentially recent, now has to do a fellowship. So if I do my 3 years of pediatrics, if I wanted to be a hospitalist, I have to do another 3 years of fellowship, or maybe it's 2 years, 2 to 3 years of fellowship to become a hospitalist. That is something that's recent. I think a lot of people are turned off a little bit by that because it's more training. And if I think about my adult counterparts or like my IM friends, they can actually be a hospitalist right after their 3 years of residency. So it's a little bit unfair. It's a little bit I don't know, I guess upsetting that we need to do a little bit more work, but also you get a lot of valuable experience during those 3 years or 2 years or whatever it is. So I think that's helpful. So that's probably one of the more popular specialties, hospitalist medicine in pediatrics. I think cardiology, gastroenterology are also at very, very high up. PICU, NICU, those are also pretty up there. And then things that aren't as popular, I think, are like endocrine, like endocrinology, as or allergy and immunology. I don't think is up there. I think those are probably lower. Child abuse might not be up there. Unfortunately, I think as a nation, like our pediatric subspecialists, we just don't have a lot of them, just because a lot of times doing another extra fellowship means that you get paid less than just being a general pediatrician, which is kind of appalling to hear. But that is just how it is for pediatrics. We just get lower compensation. So I don't think any of us are going into this for the money because there's not, I mean, compared maybe to the American population, we're getting a little bit more, but there's a lot of other ways to get a lot more money in medicine than pediatrics. So we're all going into it for the right reasons, which is really nice, because we all just love kids and we are all trying to think about child health. And so that really makes it like a unique kind of combination of all the people that come in. We're all going into it for the right reason. But I personally am interested in gastroenterology. I think that's been really fascinating for me, just having like what seems very simple can be very complex in terms of pathology. And there's a lot of interprofessional collaboration with nutrition is, a big part of it. Of course, the nurses, people like that, but also like surgeons. I think we collaborate really heavily with the surgeons as well. So that's what I'm interested in. A lot of people still choose a general pediatrician route because we need a lot of them. I think that's primary care. That's probably the most important part of medicine, is to have a strong primary care base.
And did I hear right that you said child abuse is its own like subspecialty?
Yes. I don't know. I think it might be still 3 years to go into it. Yeah, I'm not super sure. I remember we had a couple lectures from a child abuse pediatrician in South Carolina, but I'm not sure exactly what happens, but I'm pretty sure it's its own fellowship. Developmental and behavioral pediatrics is also probably a less common specialty, but is a huge need. They treat a lot of like the ADHD, autism. So there's a huge need for subspecialists is my whole point with that.
Yeah, and it's also very interesting that you would imagine if you subspecialize or specialize further, you like the compensation would be higher, but it's
Yeah.
interesting that it's the other way around.
It's unfortunate. It is unfortunate. I guess that's all I have to say about that. But I think you always should find your passion and go about it. Like, even if I might be getting a little less if I go into GI or wherever it is, like fellowship wise, I think I will be doing what I love. And that's like the
Mhm.
most important thing.
Exactly. Yeah,
Mhm.
definitely. All right, so we only have about 12 more minutes left. So if anyone has any questions, feel free to use the chat or Q&A function. But for the last 10-ish minutes or so, I'd love to talk a little bit about your um, like journey prior to med school.
Yeah.
So obviously you were an incredible student considering
Mhm.
you were in like an accelerated program. So what were some things that you did in high school and undergrad to kind of put yourself in a position to go to med school early? And then just for context, most of our listeners are either undergrad students or high school students.
Okay. Gotcha. I had the privilege of knowing that I was interested in pediatrics and children from a very young age. I think for everyone like listening, I think like kind of trying to get the experiences in that specialty is really important. So something that I did in high school, I was part of like Winter Days at Spring Valley, which is like this like I don't even know how to describe it. It's like this holiday charity thing that we were all like working together to help the community. So I was part of the Make-A-Wish Foundation. So that is like one of the like my first experiences with like children. And so the Make-A-Wish Foundation, we were able to raise money to grant wishes to children with terminal illnesses. So I remember my year we raised about like $22,000. So we were able to send almost I think 3 children. We were able to grant a wish, and a lot of times that comes in the form of like going to Disney or something. So that was one of my first experiences with children, and I kind of had like an inkling towards it, but after that experience, I was like, oh, I kind of like it. I want to dig a little deeper. And so during undergrad, I kind of had that same headspace. So I tried to find a lot of opportunities that were in pediatrics. So I did a lot of research in autism research. What else did I do? I was a medical assistant at a local pediatrician's office, so I got to see children. And I think with every single experience, I was like, okay, I think this is the right specialty for me. I'm kind of diving into it, and I like it, and I kept kind of going with that even into medical school. So I think if I have like I guess one of my biggest piece of advice for people like early on is like if you have an inkling towards a specialty, try to find opportunities to explore it further to see if you like it. There's always time in medical school to dig deeper into a specialty. Everyone says 3 years is a lot of time. Sometimes it doesn't feel like a lot of time. I know I had a lot of colleagues in medical school where everyone says like the first 3 years of medical school is a good time to decide, but really your third year medical school is when you get the most exposure to all of these specialties. And I definitely had a lot of friends that were, up until the wire trying to decide what they wanted to do because it's a huge decision. You're going to be working like at least 40 years of your life in this specialty. Like you want to be happy, and you want to really love the work that you do. So I think it can be a lot of stress. So I like being so early on, I think use this time to your advantage, try to explore things like that. And it's never wrong to be super confident in what you're going to explore right at like the first day of medical school. I was interested in pediatrics then. I did my OB-GYN rotation. I really loved it. And so for maybe a month, I thought I was going to be an obstetrician gynecologist. And then I went back to the children's hospital for like my child's psych rotation or something like that. And I was like, this is home. Like this is a feeling I want to feel for the rest of my life. Like I just want to feel at home. And that was pediatrics for me. So I think finding that passion early on when you have the advantage of time is really important, because I do know a lot of people that eventually found the right specialty, but it's really stressful knowing that one decision that they're making right now has I won't say consequences, but like has a trajectory for the rest of their life. They will be practicing in that medicine. They're kind of pigeonholed into that specific specialty for the rest of their life. And not to say that you can't choose different things and get still involved in other specialties of medicine. Like, for example, going into family medicine, you can still really be involved in like women's health. So there are different avenues, but exploring during this time is probably one of the biggest things that you can do for your future.
And so you were interested in pediatrics from the beginning and kind of leading on that. So
Mm-hmm.
if someone were to be completely uncertain, should they just go out and shadow? Like how do we find, or how do we explore our specialty interest and that kind of thing?
Yeah. Um, yeah, that's a good question. I think I would start by shadowing. If you have any sort of inkling towards anything, I think trying to find shadowing in that specialty. So if like you have any interest in bones and like orthopedics, like go to like orthopedics has clinics, like you can try to get involved in that and try to shadow in that, try to get involved in research. And if that's something that you absolutely hate and you're like, I don't think I can do this, try to figure out a different route. If you want to be as like broad as like I want to work with adults, like I want to go into internal medicine in the future or family medicine, those are really broad, but trying to find research in adult medicine is really helpful. So trying to find it in different disease pathways or even basic science research in like diseases and things that has direct applicability to like adults is helpful. So any small interest that you have. Also during college, I had a lot of, not a lot of, but I had some professors that were doctors. So even setting up a meeting with them, and just talking about your class, but also like trying to dive into different topics and like what their day looks like being in that certain specialty, I think is really helpful. Um, but yeah, I think a lot of people really like a lot of different things. And so it's hard to know where to start, but I think starting anywhere is going to be helpful rather than just kind of being like, I don't know what I like. So just even diving into the smallest of things, I think can be helpful.
Yeah, and I also think it's cool how you were able to loop in like extracurriculars unrelated to medicine directly, but you're
Mhm.
still working with like the youth population. Like you said, Winter Day still worked with kids. And so although you weren't specifically, that's not medicine related, you're still around the same things you're interested in.
Exactly. And then like even volunteering, like I volunteered in the children's hospital, like going, that was like a, wow, that was a really long memory. That was like really far away. But anyways, so like even working in the children's hospital, like that was again, not exactly tied to like all the things that I need to do, but like working with children in a way, um, again, like kind of affirmed that interest. So just finding different opportunities. And I think I volunteered at a library growing up too. So all of those things, I think it was just like everything coming together, and I was like, yeah, I think pediatrics is right for me.
Sweet. All
Mm-hmm.
right, so there's two questions that we ask all of the specialists on our webinar.
Mm-hmm.
And so the first question is, so especially now, burnout and I guess like mental stress is, I guess like higher than ever, at least statistically. So what are some ways in which you deal with that and cope with it? And what are some strategies that you'd recommend for other people to avoid burnout?
Yeah, I think that's a great question. Thankfully, I don't think I've gotten to that point yet. But of course, the winter seasons are coming up, and the lack of sunlight. So that is, I think, is a very real thing for a lot of different people. I think really finding things that you enjoy doing. So like I love this time of day in my apartment. I love like turning on these all these yellow lights and having a cup of tea in my hands. And I think it's really like helpful to like reflect on the day during that time. And also like I think being so grateful for where I am is like that's always something that's on my mind. I think like after match day, I match into my like number one program. So I'm super grateful to be here, and just like always reminding myself of that is like super helpful. Like I'm driving and I just see the Atlanta landscape and I'm like, wow, like I don't know. I think reflection is so important, but like I just find myself being so grateful for like the opportunity that I have. And so even if the days are long and if they're hard and I have like a million things in front of my plate to do, I think just reminding myself that I'm in such a privileged position to be where I am, and I could help children in the future. And that's exactly what I've kind of worked my whole life towards. So I think that's something that I like to do. I think I like to think about where I started and where I'm now, and how I can't really take anything for granted because it's like it's all here for me. So that's what I like to do. I like to do other things that, I like to de-stress at the end of the day. I honestly enjoy. Sometimes I enjoy the Atlanta traffic, which is really crazy to say, but I like the de-stress. Like I like to just like sit in my car and just like I don't know, my head can be anywhere, and I just like that 30 minutes or whatever it is on a bad day to get home. A lot of people don't like that, but I like that. Or just like tuning out, listen to a podcast or talking to family. That's something that I like to do. Um, yeah, I also love where I live. So I think having a lot of different people, like I live so close to some of my best friends in or in residency. There's so many things to do. So I like to find what I used to love to do, or like I just like finding things that I know has worked for me in the past and just like kind of implementing them now. And just like when I'm off of work, like I don't think about it too much. I really try not to do that. I think that's something that is a skill to be built, especially when things go wrong at work. You just like find yourself thinking a lot about it. Um, but like for your own well-being and for the patients that are like your patients the next day or the next week, I think it's really important for you to just like tune out, and just stop thinking about all of it, and just be a human for a little bit before you have to be a doctor again. I think that's been helpful.
So reflection and gratitude are like a fairly common thing that we hear amongst different physicians. And I'm curious, do you have like an active way of doing these, whether that's talking to someone? I heard someone recently said they do like voice memos or journaling, or Or do you kind of just passively just or became in the practice of doing these things?
Yeah, I think so after match day, I had a lot of time to myself. Like that is historically known as like the time like for you to travel and do all these things. You just don't have a lot of medical school requirements at that point. So I think after that, I built into my like daily practice that I could like I don't know, just think about how grateful I am for everything. And I think having like matching at my number one institution was like kind of what triggered all of it because I was like, wow, like I have made it so far. And I get to do what I love. And it's a privilege to be able to do it. So I think around that time I started to like think more about it. But I think it's a very passive thing for me now. I don't really I wish I made it more active, but it's just life comes at you and I think it's more of a passive thing. But like even just driving to work and like Atlanta is like very much so a they call it a city in a forest. So just like seeing the beautiful landscape is really nice. I go one of our main hospitals is like a 16-story building. It's all windows and it just overlooks all of Atlanta. And our resident room is on the 16th floor. So I truly have such a beautiful view like every single day going into work and just being able to see like all of Atlanta and all like seeing mountains in the in the periphery. I think those are like my biggest times where I'm like, I'm so grateful to be where I am. So I think it's more passive. I wish it was a little bit more active. Because some hard days really get to you, I will say. But yeah, I think that's a great way to prevent burnout. I'm glad that other people that you've also interviewed are kind of in that same realm that that's one of their active ways to fight hard times.
Yeah, yeah. It's something I've recently heard, and I think it's super important just at any
Mm-hmm.
point in your journey to just reflect. And
Mm-hmm.
because I guess in a way, a lot of us are in a place that we had previously wished we were, or I mean,
Exactly.
like we previously wanted to be here, and now we're there, and it's we
Yeah.
don't often give ourselves the credit for it.
Yeah. I think that's like one of the biggest things. Like we are in a hard like career. Like this is not going to be easy by any sense. Like residency is known to be hard, medical school is known to be hard, being a pre-med student is known to be hard. All of these things are hard, but just reflecting on things and knowing that you're going to help people in the future is like such a like a rewarding thought to feel. And when you're finally in the position to be able to do that, like having times like I had a patient for 2 weeks, I think. At the end of her hospitalization, she ended up like writing a letter to all the doctors and all the people in her hospital stay. And I had that note like on my refrigerator for like 3 weeks. I like every time I looked at it, it just like brought me a piece of joy. So even things like that, just like making sure like I just like remember the help that I've done for people already, even as an intern in pediatrics. I think just reminding myself that has been really helpful.
Yeah, that's incredible. All right,
Mm-hmm.
last question
Yeah.
is, and you already touched up on this a little bit, but if you were to convince the people listening to this right now to pursue pediatrics, what would you say to them?
That's a loaded question. And yes, I touched a little bit on this earlier. I think one of the biggest thing is that it is such a fun specialty. Like I don't want to say anything about any other specialties, but we have so much more fun in my head than other specialties. Like I dress up every year for Halloween. Um, I was a black cat one year, and it was really easy to be a black cat because you just wear black scrubs and then a little headband. But you dress up for like everything. Like I don't know, it's just so fun. Like we have so many things that we do, and it's incredible. We have little robots that go around the hospital, and they're decorated. And so even like our X-ray machine, a lot of times our patients get X-rays on the floor, so like in their room, and it's all decorated to look like a wagon or something. And I think that's just so fun. Like it brings a little like ounce of joy, where I don't know that an adult hospital would have that same joy. I think adult hospitals have the reputation of being kind of sad places, and that's honestly the reputation I have in my own head. But children's hospitals are bright, they're colorful. Are like the complete first floor of it is like trees, like have fake trees and things like that, and it's a beautiful, beautiful hospital. And we just have so much fun. Like it's like I go into work every day and something always like kind of makes me happy. Like I don't know that I would feel the same way in any other specialty just because that's me. But we have so much fun. And I think again, seeing how resilient kids are is like the biggest thing. Again, they have short hospital stays because they get a lot better really quickly. And then they lead their normal lives. And then you get to see them as a well child check, in the hospital. And then you get to see how they've progressed. One of our biggest things, like that is very pediatric specific, is like the growth chart. And essentially it's like a bunch of lines where you plot where you are in terms of weight, length, and all that, but you get to really truly see them grow. And again, you get to see them like develop their own personality. You get to know what their hobbies they're doing outside of you know, the hospital and things like that. And then I think another thing is that we really are trying to set these kids up for success for the rest of their lives. I think it's so crucial to have good pediatricians, so that we can set up kids for success. I mean, like a lot of our kids, unfortunately right now are obese or having effects of that, having diabetes, hypertension, things like that. But if we can prevent that and stop it in its tracks now, I think they truly have like a good life ahead of them. And I don't think you can do that in any other specialty. You can't prevent something so early on in life, like that. So I think it's a very unique specialty that I love, and I know everyone around me loves. So yeah, I think that's more than what you asked, but
No, that was
great specialty.
that was a perfect answer and very, very convincing. So thank you for that.
Yeah.
Um, I don't have anything else. Is there anything else that you'd love to leave everyone behind with?
Mm. I'm like trying to think of something that I think would be helpful to hear. I think something that I would have wished I heard earlier on is like take every opportunity that comes your way. And if you don't feel like there's enough opportunities coming your way, create something for yourself. There's a lot of times where I felt like there's things coming my way and I just like maybe need to apply for them. And I think like if something comes your way or like you're looking out for something, definitely do that. I think a lot in undergrad, I did like a lot of summer internships that I had to go find for myself. So I think that's something that I did, but I did a internship after the first year of medical school, and I think it was like a really nice moment because they said they specifically chose me for that internship because of some of the past experiences that I've had, and it really aligned with their goals. So that felt like a really great moment where I was able to reflect and be like, okay, things that I've done in the past are setting me up for success in the future. And then, if you feel like the opportunities aren't right for you, trying to create them yourself is huge. And I think, Sham, you're a great example of that. Like you've done so much. But one example for me, I started this program at the UC School of Medicine for children that we tutored that we found to have like food insecurity. And I remember being like, what are we going to do about that? Like, we can't just like sit here and do nothing about it. And we ended up applying for this national grant and we got it. And so now we have like, for at least for the time being, at least 4 years of funding to help children in Columbia, South Carolina with food insecurity. So that was one opportunity where I was like, I can't just sit back and do nothing. And so like me and a couple of others just came together and created an opportunity for us and for people down the road as well. So there's a lot of passionate people around you. So use your friends, use all of those people, but always say yes to an opportunity that you feel like could actually help.
I think that's great advice. I definitely need to hear that again, so thank you for that. Well, that kind of concludes our webinar and informal interview questions. If anyone has any other questions, you could always reach out to us and ask these questions on our website. Just visit the link in the chat, flip over to the resident page, and just type in questions there, and we'll make sure that they get answered. But Sreeja, thank you so much for spending your Wednesday evening with us. I appreciate it, and I found everything you said to be incredibly useful. I'll be sure to share the podcast and webinar link once we have it uploaded to the website, YouTube, and Spotify.
That would be great. I look forward to seeing it. Thank you for having me.
All right, thank you so much. Have a great rest of your evening.